Hello, everyone. This is the Cell Podcast powered by Audrey Sickle Cell Foundation. And today's episode, we have with us in the studio our special guests by the name Dr. Blessing Izewu. You're welcome, sir.
Thank you so much for having me.
Yeah, so this we're going to be talking about your experience dealing with sickle cell warriors as a doctor from the medical aspects, and also not just the treatment part of it, your relationship with them and everything that entails your field. I hope it's going to be an interacting one.
Yes.
So you're welcome, sir.
Thank you.
First of all, I would love to ask on your clinical experiences, what inspired you to go into treating sickle cell warriors or sickle cell disorder? What encouraged you? Why did you, of all ailments, why did you pick sickle cell disorder?
Okay, thank you so much. When it comes to the field of medicine,
Yeah.
it's all about empathy.
Yes.
And in every case, you see people in pain every day. So
True.
your
Very
focus
true.
is, how can I take this away?
Yeah.
Or how can I help to alleviate this pain?
Okay.
So when it comes to medicine also, you want to make people better. You want to make the society better.
Yeah.
So that is your focus. So I have over 10 years experience as a medical doctor.
Wow. That's
Yes.
that's a huge one.
In taking care of patients,
Okay.
and inclusive of sickle cell patients.
Okay.
And the emphasis and the focus is that you want to make sure they live better than the way they came.
Okay.
Because most time when they present with a severe pain, bone crisis,
Yeah.
acute chest syndromes, and those other
VOCs,
VOCs and
yeah.
everything all combined. So they might be better like yesterday.
Yeah.
Something could just precipitate the pain or could precipitate that illness at that
Yeah.
time they present to you.
Okay.
So you as a doctor seeing them, you know the pain they are passing through. So
True.
what is your next step? Can you help them get better? And can you make them better to leave the hospital on time?
Okay.
So the focus is show empathy, make them better, then rehabilitate them back to the society.
True. Wow, that's a good one. That's a good one. I must say, because I know that of course the hallmark of sickle cell disorder is pain
Yes.
majorly, and that alone should arouse empathy in anyone who has human feelings. Okay, that's a good one. So, how have you seen sickle cell disease impact patients' quality of life? So, your experience with a sickle cell warrior, of course, during our free clinics, you've seen many of them. You've even, of course, you've treated me also. So, how has this period impacted your life as a doctor?
Okay. First thing is that it's a thing of joy when you go out and you see someone waving you, doctor. You can remember so time you attended to me.
Yes.
So you don't say, this is the same person I saw some days ago. Looking as if
all
there's
hope was
no
lost.
strength at all. All hope was lost.
Yes.
But the happiness is that they get better.
They get
But the
better.
important thing is that when you come in contact with them, we call it the kind of care you should show them is like a very special care,
Okay.
because everybody could come with an element of pain, but their own could be
At the
a little
extreme.
bit extreme.
Yes.
So you have to be open-hearted. You have to show that empathy that, oh, can I make this person more better? But that empathy, that open heart, communication is one of the key.
Okay.
So you have to ask them, where are you having the pain? How worse is it? How is the pain threshold?
What's
Can
the
you
level
score it
of
within
pain? Yeah.
0 to 10? The way I usually
Yeah.
ask you, 0 to 10, what will you score it? Is it very
Yeah.
severe? Is it intermediate? Is it worse? Or is it less? So when you score that aspect of it,
Yeah.
the next plan is to start treatment. So the important thing is that between 48 to 72 hours, you want to see them better than when you see them initial
when they
time.
came in. Okay.
So if you don't see that means you have not done well as a doctor. So when you see the patient better within 48 to 72 hours after the initial presentation,
Yeah.
you'll be very happy that you've done something worthwhile.
So
For sickle cell patients, most time there are some cases you could not tell this person is sickle cell when they present early. The child could be frequenting the hospital frequently.
Yeah.
It's on later time you say, look, let me do your genotype and check. That's when you
are
pick it up.
presented with
Two things. The parents could not have been aware because maybe they didn't do their genotype
on
prior
time.
to when she had that pregnancy and when they put to bed, and after the child start having heinous up frequently. So you say, okay, let's check the genotype of the child. You know, oh, this is it. So the next thing that comes in is counseling. How would they be able to monitor that special child? It's a special child. We call them special children. So how would they be able to monitor that special child? What care would they show? Because it's already facing them.
Yes.
Life's already facing them.
Yes.
So what is the next step to take? So the important thing is we are all the same, but not because of the heinous or because of the condition that you not stigmatize them. So you don't put that as your focus. Your focus is that you should be more caring, and you should show that empathy towards them.
So
thank you.
I'm sure that has made you, of course, more caring and more. You pay attention to details. Yes. That's a good one. Thank you so much. Thank you so much for this insight. So I'm going further to talk about patient-centered care. How do you prioritize your patients, a sickle cell warrior's care, as related to someone else who is also on admission? You know, how do you prioritize taking care of a warrior and taking care of someone else who is also sick but not a sickle cell person?
For warriors, when we see them initially, you already know. So the plan is that you have to sit down and you have to be detailed.
Okay.
Because the other person you're talking of might just be pain-free under a few minutes.
Yes.
The warrior kind of person, the pain can still be persistent. After getting some freedom, the pain comes up again. So you have to be sure that that's your 48 to 72 hours window.
Yeah.
You keep a you keep a tag. You keep
a close watch.
A close watch. So the care has to be optimal. That is the truth.
Wow.
So you have to keep a close watch that the person gets better than the way you met them. So other persons might present to the hospital with pain, abdominal pain, or other complaints, but within few minutes or so, they will get better.
They'll get better.
But that of the warrior, it could still be recurrent for some time.
Especially if it's a bone pain.
If a bone pain. Jesus. So the pain keeps coming back and keep lingering for some time.
Bone pain
before
takes
it wins
a longer time.
It takes a longer time.
Oh,
or if there's a wound, a sore, an injury, if there's a acute chest syndrome.
That's
so
another
those can
thing.
Take severe, they can take a long time.
A longer time.
So you must
heal.
put a close eye. You must keep that focus that this person needs to get better.
Oh, wow. Thank you so much, Doctor. This is really getting interesting. Okay, so I want to say, how do you foster community support? So in terms of the free sickle cell clinic we run, of course, this is a sickle cell community now. You are presented with different patients. I would say, is your approach the same with every sickle cell warrior? Do you handle every warrior the same way? You handle warrior A, warrior B, because this is a community of people now. They come in their numbers, especially on our free clinic days. So what's your approach? Warrior A different or warrior B, like that? How do you just...
Okay, every individual will be treated differently.
Okay.
Warrior A could be presenting with just complaint of mild headache. Warrior B could be presenting with chest pain. Warrior C could be present with pain at the hip or different. So everybody with what they present with. So you have to tackle each of these problems at the time they present to you. Yes. So everybody could not be presented with the same. Some will be stable. We just complain that I just feel weak, tired.
Yeah.
But everybody with their own individual differences. So not the same way you will attend to each and every one of them. But the truth is that pain does not lie. Most time when it gets severe, you know it's going to knock the person out and flat.
True.
So the person needs support to come back up.
True.
So everybody, warrior A, warrior B, warrior C, everybody presents differently.
Okay. There's a topic I want us to deviate a little bit, talking about addiction.
Okay.
And warriors. Of course, we know that the pain threshold most of the time is on the high side. And because of this, a lot of us are already seen as drug seekers from the medical aspects. You present, to a doctor, and you tell them, this is what works for you, this is what I'm used to way back. And some will say, no, I will not give you this, I'll give you this. I would insist you go with this, and let's see what happens when you take this, rather than taking what they are used to, what they've always fallen back to. So how do you handle it? Let's say a patient comes to you now and says, I am used to taking this drug. In your presentation, what do you do? Do you already have this preconceived notion that, oh, this person is already addicted, or how do you handle that?
First, when it comes to pain,
Yeah.
our biggest fear is addictions.
Okay.
And when we talk about addictions, addictions are not easy to deal with.
True, very true. From experience, yes.
Initially, first thing first, the books say start with the low dose painkillers.
Okay.
Then you could titrate upward. So the truth is that's why we use the pain threshold score to score whatever pain the person is presenting on. So the person comes with a pain of 8/10, 9/10, you have to go very high.
Yes.
If they come with 5/10, you could step down a little.
Okay.
Because the biggest fear is addictions can be very difficult to deal with.
True.
But the thing is that you have to be in that person's shoe. You could be feeling that the pain could be mild, but it could be something very severe.
Also very severe, yes.
So you could say, this is, but you walked into the hospital. You stroll into the hospital. You think the pain is not something you could bear. But the thing is, communication is the key. If you don't discuss with the person about the management plans, that is where the problem usually comes from.
Okay.
Some persons, the truth is that every individual is tailored to the kind of medications that fits them.
True.
Some could take a particular medications and feel nauseated, and they ate that medications for life. While some persons will take a medication and they feel better and cool in themselves.
Yeah.
But the focus for our patients most time is that we don't want addictions.
Okay.
Because it's very difficult to deal with. Dealing with, you've already dealt with the pain, and the person is pain free. The addiction is another problem you start battling with. So try as much as possible. If you communicate, if any doctor handling a patient that has this, you should be more focused on communication. Okay, if for the pain, can I start on this for the next few days? If it doesn't go down, I will step up to a particular medication. If it doesn't go down, see what we will do. So the thing is that it's communication. If you communicate the person properly, the person could understand you properly. Communication is the key. That is the truth.
Okay.
So if you don't communicate, the person will not. You just feel, okay, you're just treating me for whatever you are doing. You are not telling me what, putting me my focus
into consideration.
So try as much as possible. Communication is the key.
Okay.
If you communicate properly,
you get a better result.
You get a better result.
Okay. That's good. Thank you so much. It's really getting interesting. So about advocacy. Now you've been into the sickle cell community. At least I know you've worked with Audrey Sickle Cell Foundation for a while now. So how do you tell people, how do you advocate about the disorder? How do you advise your patients who are probably incompatible, wanting to go further with their marital decisions? Or how do you advocate about sickle cell? How do you talk to people about sickle cell, judging from your experience?
For sickle cell, as a doctor, the happiness is not in the marital enjoyment as at that initial time.
Yeah.
It's what in the next 3 years, in the next 5 years, in the next 10 years, in the next 15 years, in the next 20 years, what are we going to achieve?
Yeah.
The truth is that in Africa, most persons don't know that. You can just see some group of persons don't know their genotype.
Very
it's
true.
Time to get married.
Very true.
Yes.
Very true.
So we have been having that.
We come across that a lot.
So marital counseling is necessary. Most churches are now even adopting it.
Yes.
As part of their focus. That before you get married, please let's have a genotype testing.
It's not costly,
but it's not costly. But the problem is that we make a mistake. We fall in love first, Before we now adjust back.
talking about
Before we now
our
adjust
identity,
our identity that I am this, I am AS, you are AS. We fall in love first in Africa, yeah. Before we start thinking. But over there, when they give birth to you,
yeah,
over maybe within 1 year, 2 years, your medical and health history is already in their focus.
Why?
They have a biodata kept well, so you already know how your life should be planned. But yeah, we fall in, like that's why I said we fall in love first before we start thinking
about our identities.
So it's not a wrong thing to fall in love.
Yes.
But please, let's use our head, because the future is at stake.
Mm-hmm.
And the child that is coming into the world, what is our plan for that child? So most time our patient will counsel them. I know you guys are lovebirds. Can you sit down and just do a genotype check and come back and tell us the results? When it comes, if you see insist, nobody stops you from getting married. But what is the next plan?
Yes.
As you are married. So we usually discuss that with them.
So which means there are better options for people who even want to go ahead.
Yes.
To get married, yes. Even when they know they are not compatible.
They are compatible.
Okay.
Some could decide they don't want to give birth. Some could decide they want to give birth and do genetic selection. They could also decide I want to still give birth and manage the case the way I want to.
Yeah.
So
I think there's also adoption.
Adoption is another option too.
Okay.
So all those counseling procedures must be well outlined. Oh. You could fall in love, but let's think it properly.
Mm-hmm. Yeah. Okay. Judging from my experience, of course, we're in this part of Nigeria. What do you see? How do you see sickle cell advancing to better health outcomes, or drug or things that will just elevate the sickle cell community and make it better for those already living with the disorder? Where do you have hope that this country is getting somewhere with sickle cell disorder and its advocacy?
Yes, people are now seeing the truth and reality.
Okay. As compared to 5-10 years before, yes. ago, 20 years ago,
20 years ago, 50 years ago. Many people just say, this child, something happened, the child died out of pain, and the child just died. They don't know what caused it. So now people are now more exposed because of what foundations like yours have been doing in that light. So going around trying to tell people, this is people about it. So people are now more exposed.
Okay.
Compared to before. Then there's also some newer technology research that is being carried on medications to manage the condition.
Yeah.
Also the biogenetic part of it, biogenetic selecting.
I think there's this amniosynthesis or something.
Yeah, amniosynthesis and all those many things. Then medications being exchange blood transfusion.
Yes.
So there are newer research ongoing.
Okay. But these things are not cheap.
They are not cheap. They are costly.
They are not cheap. It's not something that the ordinary man can afford.
They're not cheap.
So do you still think that there's hope for us in this country, Nigeria? That's the thing. We'll start from here before we go outside.
Yes, there's hope.
Do you think there's hope? Because I think that bone marrow transplant is not cheap.
It's not cheap.
If it were to be cheap, maybe I would have. It's not cheap.
Drugs, medications.
It's not cheap. Hydroxy is not. So everything is just on the high side. I still feel that
there's hope.
Prevention is better than
prevention is better than. But we are praying that there are foundations that
come
in,
yes,
and make this thing. The prices of things come
maybe
down.
Bill Gates,
Bill Gates Foundation,
Audrey Sickle Cell Foundation in a few years
to come. If money comes in, you can get a clinic for bone marrow transplant.
Yes,
it's possible.
Yes. So we have all of that in the works. Let's keep it
it's
pushing.
Possible. You just see that most time I know the attention might be focused on different parts of illness, maybe HIV or other conditions and that. People are more focused on places that will give them more money. Tuberculosis. But the truth is that every illness has its own peculiarities.
True.
So somebody could focus on attention on that and think, let's move money into that direction,
and see
which is
what
very possible.
Works. Yeah.
So there's hope.
There's hope for us. Okay. That's a good one. So I think in rounding off, I would love to ask again. If you have a patient presented with you now who is deep into the addiction thing, how do you handle it, to in order not to also make the patient feel that everything is at a standstill for them? Because of course nobody wants to be in pain 24 hours or weeks or months. So, and I'm sure that's what leads to addiction. Just
Yes.
that's 1 minute,
I don't
one
want. I
hour,
don't want the
one
pain
week,
at all.
yes, relief. Before you know it, they are really deep into this addiction thing. And such a patient is presented to you. How do you think you would handle the situation? What's your best method to make them also not feel like, oh,
They're
all hope
being
is lost?
stigmatized or hope is
Yes.
lost. For most time, we usually counsel, we like the family be carried along. Because
Okay.
most time when it comes to family, if the family support is there, the person gets better faster.
True. True. Very
So we
true.
always advocate for family support. So there's nobody that is an individual or an entity of his or herself.
Yeah.
You can't be on your own.
Yes.
So if there's support, anybody that has a support structure, it's possible that you could get better. So for those that are addicted, if you can get a family support,
Yeah.
we could help better. So like most of them, we will know that there's already an addiction issues. We have some we call it mental health physician.
Yes.
They join in the management of this patient.
Okay.
So with that, what they do usually, they substitute a medication for another one.
Another one.
It will still give the same pain
Effect.
control.
Yes.
Why some they can substitute a placebo for the same condition.
Okay.
And see if the pain could be minimal as much as possible.
Mm.
So the thing is that we try as much as possible to wean someone off medication. Don't be used to it. Even medications, the truth is that drugs are poison.
True.
So
even paracetamol, I heard
itself,
that.
yeah, all drugs are poison. So we try as much as possible. We don't want you to be used to a particular drug for over a long period of time. So what we usually counsel: family support, water therapy, counsel on healthy diet,
Okay.
counsel on lifestyle modification. Just try as much as possible to light exercise, brisk walking, other things. This could help with circulation. So the important thing is that those 4 indices, if they are there, the person could get better.
Okay. It's all right. That's actually a good one, and I want to say that you've really done well coming to join us on this show and giving us a little insights about your experience dealing with sickle cell warriors. So I would like, before we round up, I'd like you to throw a word of advice to sickle cell warriors and doctors who are upcoming, who would want to, of course, specialize in taking care of sickle cell warriors, because I know that in Nigeria a lot of doctors are running
From that
direction. So what would you advise an upcoming doctor and also a warrior on how to relate with a doctor when they are in pain?
Okay. For this, we say the truth is that you already know the person's condition.
Yeah.
Try as much as possible to bear with the person to the barest minimum. Try as much to be patient. Be open. Be transparent. Then the counseling is necessary. Communication. Like I said, communication initially.
Yes,
if you don't communicate, the person doesn't know what you are doing for them. So the thing is that they need support.
True.
They need support
from
anywhere,
all sides. Yes.
Family, medical team,
support.
Everybody needs to be at. It's not they didn't create the problem.
Yes.
They met the problem. So
yes.
how do you make them get better in that instance? So try as much as possible as a doctor. Be empathic.
Yeah.
Show that love that, I want this person to get better. We should not be in a rush to make rash decision or be angry towards that. Displace their complaints. That let me just put it aside. No. Try as much as possible to be in their shoes.
Yeah.
Yes, because we also have some doctors who are sickle cell also.
True.
And they are musicians.
They're doing well.
Even musicians, many persons in the society.
Yes.
Top level persons in the society. But they try as much as possible to manage their condition. So that person that you're looking up to could be the next president of this country.
True.
So try to
be accommodating.
So you don't know who you are attending to could be the next president. Yes. So try as much as possible to be accommodating. Even those of us that are head personnel, some of us, Some persons are suffering the same condition.
True.
So you will not still dismiss them because they are
because
your colleagues.
they are your
They are
colleagues.
So
Yes.
you have to still be in their shoes.
Okay.
Thank you so much.
So that's a very good one. Thank you so much for coming on the show today, and we hope to bring you back. Of course, you are our doctor. We don't personalize you. You don't get where you go. We'll bring you back again. And to our viewers, you've heard all that doctor said. I think we should have an open mind and also give people, show the empathy. That's what matters most. And to this, we come to the end of this segment. And I would like to say, follow us on all social media platforms, Audrey Sickle Cell Foundation on all platforms. That's our handle. And from there, you get to see more episodes as the time goes by. Thank you for having me.